Medical Watch for you this afternoon, the silent lung cancer threat inside your home.
Medical reporter Dina Baer has more on what you need to know and keep your family safe.
You can't see it or smell it. Radon is a naturally occurring radioactive gas that emits from the ground. You've likely heard of it, but what doctors want you to hear are the health risks that rise with increased exposure.
It can be in homes, it can be in schools, in any building possible.
Radon comes from radium, which forms when uranium in soil or rock breaks down. The gas enters through cracks in walls, basement floors, foundations, and other openings. Levels vary, not just across the country, but from home to home, within a particular neighborhood. The Midwest is known to have particularly high levels.
Radon, because it's a radioactive gas, it can enter through our nose, it can enter also through our eyes and through our mouth and enters into the lungs, and these radioactive particles basically change the cells in our lungs and can promote the growth of cancer.
According to the American Lung Association, there are 21,000 radon-related lung cancer deaths every year. Smokers have an even higher risk, though people who have never smoked make up 1 out of 7 radon-related lung cancer deaths annually.
It's the #1 cause of lung cancer in people who do not smoke, and it's the #2 cancer in terms of lung cancer overall, is the #2 cause.
The only way to know your risk is to test the air in your home. So, what level is considered a health threat? In the U.S., radon test results are typically reported in 2 different measures. If your reading is 4 picocuries or higher per liter, or what's called a working level of 0.01 or higher, the EPA recommends you fix the problem by installing a vent pipe and sealing any cracks in the structure.
The mitigation itself involves placing PVC pipes with a venting system to bring the radon gas out of the home and outside so that it goes outside of the home. And yes, it can run possibly $2,000 when we're talking about doing this.
Like the gas itself, the signs of radon poisoning are often silent and can take 10 to 15 years to surface.
So it's not going to be right away that we feel the effects of radon. It's over time because we can't see it, we can smell it. But people with underlying lung disease up after exposure might have symptoms, for example, increased cough, shortness of breath, or wheezing, or different symptoms that start manifesting.
The American Lung Association has more information about radon and testing. We have a link on our website. Back to you.